I'm Caroline Kenyon. I'm Director of Communications at the Innovation Agency, and this webinar is all about video consultations. Do we like them? How do they work? How well do they work? What are the drawbacks? We're going to hear from 3 clinicians, 3 paediatricians in Lancashire and South Cumbria. We're going to hear from a patient and her mum, and we're going to start off by hearing from the person who leads on IT strategy for the North West, Daniel Hallen. But before we get going, just like to say again, if you could put any comments that you'd like to contribute into the chat function, and my colleague Max Sullivan will respond to you. If you have a question for the panel, please put that in the Q&A function. This webinar is being recorded, so you can get hold of a recording afterwards and share it with any interested colleagues as well if you like. And if you want any resources that you may see in the course of the webinar, just get in touch and we'll share them with you. So just to recap, this is all about video consultations. Many hospital appointments are being conducted by video now, aren't they? Mainly, it seems at the moment anyway, attend anywhere. So uptake initially, when it was being piloted, was very slow until we were hit by COVID-19, and then everything changed. So we're going to hear what's changed and what impact it's having. And the first person I'd like to hear from, if I can introduce Daniel Hallen, who's Head of Digital Technology for NHS England and Improvement. Welcome, Daniel.
Thank you, Caroline. And I want to thank everybody else for taking the time out of a very warm and busy day to join us today. So yes, we've been rolling out Attend Anywhere or video consultation across the Northwest, across the rest of the country. Since last year, but this really didn't actually take off in anger until March, until COVID-19 started to roll across the country. It's really moved at pace. You know, we've all just in the Lancashire and South Cumbria area alone, we've had 650,000 consultations over the last 4 months. That's an average of 7,500 a day, and you know, nationally that's nearly 4 million since March. So you know, absolutely moving at pace here. Some of the real big impacts here have been about being able to see patients in a safe environment and continue that clinical care during the lockdown period and during a time when people want to feel safe. So just Lancashire and South Cumbria, you know, 45% of all our outpatient appointments are virtual. And that ranges between different trusts, but some of our trusts are delivering nearly 90% of their interactions through a video or virtual environment. So it really changes the way that we interact. And in many cases, it gives a patient an experience that is actually far healthier than making a trip for an outpatient appointment. If you think about the standard outpatient appointments, you know, you've got to get there somehow, you know, public transport driving, you've then got to park up, then pay for parking, make your way into the hospital, sit in the waiting room, have the few minutes with the consultant, and you repeat the reverse to go home. So, you know, it can take half a day out of your busy life, particularly in the new world that we live in, with families and children spending much more time in the home environment. What it has allowed is patients and healthcare professionals to manage their interactions around their busy lives and the changed circumstances. I just wanted to show everybody a quick sort of diagram that shows that some of the key benefits that we pulled out of this that aren't necessarily patient focused, but some of the broader things. So if I hit the technology in the right way, this should work. So it just shows you some of the key things that we've had. You know, patient journeys are down in terms of the amount of miles that need to be driven. We've saved a lot of carbon emissions. You know, we've avoided the need for nearly 250,000 hospital car park spaces. And I'm sure the parents will love this one, and certainly the kids will at home. You know, it's saved 368,000 school children missing the equivalent of 65,000 the school days every year. So I'm sure, you know, parents, teachers, and of course the children are very happy about that. So for us, it's you know, it's a digital solution, but this has really started to change the way that we interact with people. Back to yourself, Caroline.
So Daniel, as well as having the system available to use, what difference has it made to reorganising services? Because it's not simply a plug in and play option, is it? It's rather more than that. There is a strategic plan behind it all, isn't it, being rolled across the Northwest? Can you explain what that is and what the benefits are to managing the system?
Yeah, so like you say, you know, there's a strategic plan here. I mean, the Secretary of State has recently very much clearly stated that we want to do things in a much more virtual environment and look at where there's clinical need to be in a physical environment. So certainly across the Northwest, each trust has been taking an approach of rolling this out. Lancashire and South Cumbria has taken a very unique approach that we've tried to do this collectively across the system so that we can make sure that no patient ends up disadvantaged by any sort of response to COVID-19. So very much the strategy is about starting to move towards a blended environment where patients can have a virtual consultation where it's necessary, so, you know, as almost like we're doing now, but also then have a physical consultation where that is absolutely necessary, where there's a clinical need. And it changes the design of what we do with hospitals, what we do with different environments, because what we can't have is we can't have patients crowding into a waiting room and passing what they call nosocomial infection around. So we need to make sure that those that are attending hospital really do need to attend hospital, and those that don't can actually do it from the safety of their own home. So very much the change that is coming here is to try and make it a lot easier. Certainly from a clinical perspective, you know, it cuts down the amount of patients that actually need to be managed and administered in a hospital. And mind the clinical side of things, just the administration piece that goes through a hospital. So that moves into a virtual environment and is done in a different way, but from the actual feet on the ground, it's a very, very different environment.
So our digital teams throughout the system have been very key to this, haven't they, in making it happen? Has it been a very frantic time then at the beginning to get it all in place?
So it's a common thread of thought that goes through our digital teams at this present time, that we have probably done 4 to 5 years of strategy in about 4 months. So, you know, we're trying to push digital, and digital has gone from being, yes, we want to do this sort of thing, to the point of actually we need to do this sort of thing, and we need to embrace some of the digital technologies that are out there, like virtual consultation, to make sure that we can still deliver healthcare, but in a safe and, well, dare I say, socially distanced way. So it's, you know, digital teams have been absolutely busy, and you know, we celebrate the NHS across the whole spectrum of healthcare professionals, administrators, and digital that have worked very, very closely together to deliver this sort of thing. So, you know, we have consultants and healthcare professionals approaching us almost on a daily basis saying, I want to set up a virtual clinic, how do I do this? So it's, you know, there's a lot of stuff that goes in behind it, because it's not as simple as picking up a mobile device. You know, we have to make sure that the screens are of the right quality, the cameras are of the right quality, and that we have all the network connections in place. So yes, I mean, I can come back to that later as well.
Okay, but digital teams very much to the fore, to the front line. Certainly now, always, but particularly now. They are our heroes. Yes, they are among our many heroes. Yes, that's fantastic for you to showcase that. Thank you very much. So we're now going to hear what it's like on the patient side of things, and we're going to hear from Imogen and Rachel Gray, who have actually been attending a physical appointment, ironically, in Lancashire, and so they've been shown into an office and they're using an NHS computer, which we're hoping is going to be working all right, and it's going to connect us into, so we can hear from them. Rachel is 16 and she's a patient in the neurology department, and she's with her mum Rachel Gray. So we're just waiting for them to be seen. If Rachel and Imogen, if you can just turn your video on and your microphone on. You need to do that at your end before we can bring you into the meeting, and then we can hear from you. So I hope that's okay. And then after we've heard their experience and their perspective, we're going to hear from 3 paediatricians from around Lancashire who've both got some similar experiences and some shared experiences. One of whom is Rachel's consultant, Dr. Christian Dahuda. So we can't see. Oh, yes, we can see. That's such a relief.
Yeah.
Hello, welcome, Rachel and Imogen.
Hello.
Hi.
Hi.
Hi, thank you. I think that's Dr. Christian Dahuda's actual office, isn't it, that you're sitting in?
Yeah, they've let us use this afternoon.
Yeah, he's had to go to Blackburn, so you've got to use his office. I know the outpatient staff have helped you there set up, so thanks very much to them. First of all, Rachel, can you just explain a little bit about yourself and, you know, why you're a patient and your experience coming in for, and also doing video consultations?
I come to the hospital because I've got an undiagnosed muscle condition. Yeah. So you see different teams.
Yeah.
We see Dr. Dahuda and his team of clinicians, so there's a physio in there and a nurse. So we also visit Newcastle because we're still waiting for a diagnosis, really. But we have used video technology 3 times now for 3 different appointments.
So Imogen, what's that been like, these 3 appointments that you've had by video? Can you describe what the experience has been like for you?
It's been good because you don't have to like travel all the way to Preston to have the appointment. But then sometimes if you need like an actual examination sort of thing, it's not that good for them because you can't see me in person.
We have managed to do, I've like held the camera and you've been asked to do different things,
Yeah.
like getting up from the floor or like sort of hopping, various things, not everything that they can do in clinic, but they have managed to do some things. And I know the Newcastle team have picked up something they want to refer to the physio here. So it has worked, and in the current situation, it's been good to have that.
Are there some advantages then when you're in your own home having a consultation, do you think?
Yeah, I think so, because you're like, if they wanted to see anything in my own home, me doing something, then I'd be here and they could be shown that.
Yeah, like walking up our stairs or
Yeah.
different things. And again, like Daniel said before, it does save time going to the hospital. So like when Imogen's at college, it's not as many hours out of the day really. So it has been quite good like that, hasn't it? We had an appointment with a dietitian, and I would say that was one that it worked really well. The only thing we needed was some scales, and Imogen was weighed on those, but there wasn't anything in that appointment that would have been any different to go into hospital. So that one was really good. Maybe some of the physical stuff is a bit more challenging. But it's quite nice as well because we've got a very good relationship with the muscle team. So we did feel quite comfortable and relaxed to do that appointment at home, really just past history and things like that.
So is it easier when you've met the clinician once beforehand, so it's not a whole new relationship? So if you know the muscle team, then it's easier to have a call with them, I presume.
Yeah.
Yeah.
You don't have to sort of start re-explaining things. People know exactly where you are, and like a lot of the exercises, it's things we've done before, so it's very familiar. So it was quite easy to slip into that appointment.
And you saved yourselves a trip to Newcastle, which is no small thing, is it?
Yeah.
No, because that is a long journey, so that was
good.
It was good that they could see us there, definitely, wasn't it?
Yeah, it was.
So there's just a couple of things. It wasn't like the full normal assessment because I don't think they could do everything. So maybe this system's good and maybe you do every other, or somehow you can alternate sessions and appointments.
So what would you like to see going forward? If you had a choice, what would you like to see? If you had a choice of video consultations and face to face, what would be your preference?
Well, I think it depends on the appointment, the type, because if it's something where they need to see me to like actually get a good examine me well, I think that's better face to face. But for the dietitian and things that I don't really need, I can just talk. That's better.
Maybe a mix of both would be fine.
Well, so the drawbacks would simply be when you have to have a physical examination. You don't see anything else that would be problem.
No, because I think everything else, like the time, everything ran smoothly, and
Yeah.
it takes out the stress of the journey. And if you can't find a parking space, so you're probably a bit more relaxed when you're waiting at home and you're ready. So that's absolutely was fine.
Yeah.
Yeah. Anything else you'd like to say about video consultations? Anything else you'd like to add?
Just that I feel that during lockdown, I feel like lucky that we were able to have them and things didn't stop because of like the COVID. So really, I was grateful.
Yeah, that's great, isn't it? Thank you both very much. We're going to hear from you again in a little while, but for now, thank you.
Thank you.
So we're next going to hear from our three clinicians, and they are Dr. Claire Peckham, who is consultant paediatrician and lead for respiratory paediatrics, including cystic fibrosis at Royal Lancaster Infirmary, part of University Hospitals of Morecambe Bay, NHSFT. Dr. Christian de Hoda, who is Imogen's doctor, and he's a consultant paediatric neurologist and paediatric lead for the integrated care system in Lancashire and South Cumbria, and Dr. Chris Gardner, who is a consultant paediatrician at East Lancashire Hospitals. Welcome, everybody. Thank you very much for joining us. So Christian, you're Rachel's doctor. How do you feel about having to see her on a video call now?
I think it works really well. I mean, the thing is, the alternative for not having a physical meeting is, sorry about that.
It had to happen, don't worry.
The alternative for not having a physical meeting is to have a phone consultation, and that's just doesn't work so well. I think having a video connection, it makes it more personal. You can have some, non-verbal communication going. It makes it much easier, I think. The other thing is that it's also possible to make some form of assessment over the phone. You can't really assess a patient, whereas actually I've found as a neurologist, a lot of what I do is observe movements, look at what people can do. And actually my neurological examination, I can do quite a lot. As Imogen says, you can't quite test things like strength or power directly in the very detailed assessment, maybe not, but a lot of the things that I want to see, eye movements, movements of arms, any tremors, things like that, I can see through the video. And I think the other advantage is seeing patients in their own environment. One is that they're more at ease. So sometimes they'll do things that in clinic, some of the smaller children are just anxious to do, and they might do it at home. But also we can see what are the difficulties at home. Like we saw another young man how he got from his wheelchair into his bed. And just to see how that worked at home was actually great, because then also my physio could give some advice about what might help or what you might want to avoid doing. And so I think actually it added a great deal to have that video sort of opportunity. It was almost like doing a home visit, but then virtual.
Fantastic. Claire, what about you? What do you see as the benefits of doing video consultations?
Well, there's loads of benefits. I think from my personal experience, one of the huge challenges that we had was that I'm the lead for cystic fibrosis, and I look after patients with CF right from diagnosis. And we had to build up a relationship with a family where the baby had just been diagnosed with cystic fibrosis. And we had to do it totally virtual because of COVID. And a telephone call just isn't enough to connect emotionally with those in those instances. And we were able to, I mean, this is a very important time for us because we're starting a relationship with a family that is then going to continue for another 18 years. And we were able to give sort of emotional support, and you're able to introduce the whole team basically. And we were even able to see the baby and reassure the parents because we could see the baby and we could hear the baby cough. We were even able to diagnose, pick up on that the little cough that the baby gave was probably a little bit of reflux, and we actually instigated some treatment because of that. But I think so it gives us confidence as clinicians, but it also gives the parents and the carers confidence because they can see us and they know that we can see their baby at what was for them an extremely worrying time. So I think it's just so much better than a telephone call in that respect. And we were able to, I was extremely worried at the beginning of COVID about how we were going to cope with this newly diagnosed patient. But we actually have managed extremely well. We've got an excellent rapport with the family, and we've managed to keep the baby really well during lockdown. So, I mean, that's just a personal experience. That's just one of many advantages. But I think the emotional, psychosocial aspect of actually seeing the patient is huge, even when it's a baby who can't talk to you.
That really brings it to life. Thank you so much. Thank you. And Chris, what about you? Can you pick on some examples of where you found a benefit from using video platform?
Well, I'm a diabetologist, so like Claire and Christian, I look after children and young people with a long-term condition. And I think what we know is that that these conditions aren't the sort of thing that you manage very well from a clinic room. You actually these are about how you manage life with these long-term conditions, and actually being able to see patients at home in their own environment actually can help you tailor your advice much better, because people often have the equipment to hand that they actually use for real life. So our diabetes team spend a lot of time advising on food and trying to titrate insulin doses to the food. And actually when you're in a patient's home, you can actually ask them to get the food that they eat. They can answer the questions that you have to be able to advise them, or they can raise queries about ingredients and things like that, and actually you can answer it directly. So it actually enriches the experience a lot more, and a lot of our team have been able to deliver training and education to families often much more effectively by using patients' own equipment in the kitchens, for instance, to weigh stuff out, which makes that clinic experience and the advice that you're giving much more tailored and much more usable, really, for families. I think the other thing is it can be used often to a hybrid. I think in the new world, having consultations face-to-face isn't actually necessarily a great thing, because you are often very distant, you're behind a mask, and to be able to be empathetic and to be able to read social cues is actually more difficult sometimes. And certainly some of my more difficult conversations, even though we've actually got the patient physically in the hospital on the ward, we've actually chosen to do it by video conference, because it's more effective to be able to see patients' reactions and to see families' reactions and to see their face and be able to smile at them, rather than having a face-to-face consultation behind a mask. And that's had really good feedback as well. So sometimes face-to-face, even where it is possible, isn't necessarily the greatest thing with the PPE that we have to use. I think the other big thing where we can help is the flexibility to involve other specialists and other teams much more easily than we were able to do previously.
Yes. So tell me a bit more about that, all of you, because you can bring in multidisciplinary teams, presumably, on a single consultation. Does that mean you can bring people in from different locations you couldn't previously? Claire, have you got an example of where that's worked for you? And is that better than when you were working in physical locations?
So yes, we obviously, I do, I look after general paediatric patients, but I also look after respiratory patients, and we often need another professional in the room. We do multidisciplinary clinics, so we need to have a dietitian, we need to have a physio in the room, and a specialist nurse, both locally, but also sometimes we need to link in, as I was alluded with Imogen's experience, we have to link in with tertiary units. We haven't quite managed to do an NHS Attend Anywhere video consultation with Manchester yet, but we are hoping to do that. But what we were able to do is have a multidisciplinary clinic where we had the physios. We were maintaining social distancing, so we didn't all pile into one room, and we had spare rooms. So we had the physio in one room, and we had the dietitian in another room, and the nurse and myself in another room. And actually, you can do that with the patient at home. And it was very similar to how we run our clinics, because in the clinic, we will have the patient in the room, and we will go into the room to see the patient. The patient doesn't move about. And then we go out of the room, and the other professional comes in. And it was exactly the same, but just using the video consultation. And everyone, sort of all the patients reported how they liked that. It was very similar. And as you say, Chris, even better in some respects than if they'd have been here with us wearing a mask in this current time. A lot of our patients come from a long distance as well, so they're able to stay at home. So we have patients from North Cumbria, patients from Barrow. And you know, it sometimes isn't a half day, it's the whole day out to come to clinic, which can be very disruptive to family life, especially when you have, you know, a sick child with a chronic illness. So thinking about a child who's on a ventilator at night, one of the comments that has been made by the parent that I look after her is she's the most well she's ever been during lockdown because she's not come into the hospital.
Wow.
So just a few of the advantages.
Amazing. Christian, have you got any examples of where that's working for you, bringing in different specialties maybe for your patients?
Well, it's very relevant for me. So I provide a regional service for like neurology, but particularly for neuromuscular patient neuromuscular problems in the toe management clinic. And it's very much working with allied health professionals. So I need the expertise of my OT, my physio, my specialist nurse And actually seeing families together works really well. So they can actually come into that same consultation like we would normally do in a room. And it almost feels like essential. With a phone call, that doesn't work at all. And then the other advantage is that you can actually then invite local teams as well. And as an example, a home management clinic we normally hold in Leyland, in a child development centre. Now that's not the most accessible for all families as it is. Now we do these clinics as a video clinic. And one of the advantages is that we've now often had one of the physios or the OTs from a local team join us. So it could be a patient from Cumbria that we can all join without necessarily having to travel. And that's a great advantage. A lot of the work with children with long-term conditions is about working together, and communication can sometimes get lost a little bit along the way with letters and everything. And actually having the opportunity to do a joint consultation is absolutely very, very worthwhile. Yeah.
And presumably you can invite in people from anywhere in the world if you wanted to. Has that thought occurred to any of you? Have you done that already? Has anybody thought of doing that or thinking of doing that?
Not quite yet.
Absolutely, we've had experience of certainly specialists from sort of distant parts of the UK, where you may have only one or two centres in the country who are managing a patient. And I think Imogen alluded to that with the Newcastle experience. And I think promoting that collaboration between the local team and the specialist team is actually really important. And when you think about how many bits of paper go backwards and forwards following consultations, sometimes to be able to implement a plan, whereas actually 15 minutes spent with the patient in clarifying the plan is actually really, really valuable, and allows plans to be implemented an awful lot faster, because you can get on as the local team and deliver what the patient needs. I think there's also opportunities for training. We've got some of our trainees and other health professionals who are shielding at home, and actually we've been able to continue their medical education by allowing them to join our consultations and to observe how different consultations are managed, and actually give them a much greater breadth of education on this platform than we would necessarily have been able to do with some of the restraints around timetabling, for instance, of getting people in the right place at the right time to be able to have their education. So I think, yeah, there are certainly massive opportunities, and I don't think we've fully tapped into everything possible as yet. I think there's more that we can do.
Claire, we can't hear you. Still can't hear you for some reason. I don't know if it's our end, but I'm sure our team will be checking. Oh, that's such a shame. I don't know why that is. I might have to ask Daniel to come back in and help us. We'll keep talking in the meantime. And oh no, yes, do you want to try again? No, I don't know why that is. I was going to ask you about the drawbacks. Is this the right time to talk about the drawbacks, or are there any other advantages you'd like to highlight before we do that? And you mentioned potential, Chris, the opportunities. Your minds must have been racing about the things you could do now that you couldn't do before. Are there any other kind of wildly ambitious, possibly, ideas that you've been having about what could change as a result of doing consultations on video?
Well, one of the things, we work in clinical networks, many of us, and actually this, and particularly in many of the specialised environments that we all work in, there's not necessarily hundreds of people delivering a service. And so if we take paediatric diabetes, many of our 28 centres in the Northwest might only have one doctor with really quite specialist knowledge. It's a highly technical field to understand insulin pumps, continuous monitoring devices, and many of our services are very, very fragile. And we've certainly seen within the network services really struggle due to sickness of one member of that multidisciplinary team. So a diabetes team, and it would be the same, I'm sure Claire would concur, in specialist respiratory teams, where if one member of your MDT being either off sick or on maternity leave can actually really have a significant impact on the delivery of that service. And we've often wrestled with how do we, as a network of people, make sure that we support services across Lancashire and South Cumbria. Because actually the Attend Anywhere platform sort of has a shared waiting room at the moment, we've actually already seen that there would be potential, for instance, to give second opinions on patients from other centres, to collaborate much better with centres. And we know that being able to work together, to peer review each other's practice, actually reduces variability in care delivery, as well as being able to network services much better. And I think that's something that we haven't yet explored, but there is certainly potential to do that. Great,
thank you. Claire, dare I ask, is it working? No.
I don't know.
Sadly not. Oh. No. Might have to ask you to put it in the chat, perhaps.
Yeah, okay, I'll do that.
Oh no, we can hear you now. It's just very quiet.
Softly.
You might just have to shout.
Hear me now?
Yes.
Okay, I'll talk loudly.
Thank you. Whatever it is, I'm glad it's working. So go on, you had a point you were going to make then a minute ago.
Yeah, I think it was about the importance of recognising that I think what it's highlighted to us is that very little of what we do in clinic requires an examination, actually. We do need to examine, obviously we do in some patients, but it is actually possible to see a patient and not examine them. We can do a lot by observation. And in that respect, in terms of talking about education, I think it's a valuable opportunity to actually highlight that to our students, that actually it proves the point about how much of what we do is from the history and the observation. And actually the added advantage of seeing patients in their home environment is massive, particularly when you talk about safeguarding, particularly when you talk about the emotional things that are going on perhaps at home. You know, even just hearing a child crying from an upstairs bedroom or something like that, you know, a sibling, or knowing that there's loads of pets around that they're, you know, having to quieten. That's such valuable opportunity that you don't get in a normal children's outpatient clinic. And the only other point I wanted to make was I read very recently, I think on Twitter, that a patient was able to have their video consultation clinic whilst they were on holiday in France.
Claire, can you hold that device closer? That's it. Go on.
They were able to have that vital outpatient appointment whilst they were on holiday in France with, you know, it was a really important appointment, and they were able to have it from their holiday home in France. I mean, how useful is that? That is really, really useful, and it makes the whole thing much more efficient.
Thank you, Claire. Thanks for persevering as well. So just very quickly from everybody, what are the drawbacks? We know that we can't do physical examinations, that's fine. We know that perhaps a first appointment should be in person if at all possible. Are there any other drawbacks that you can see with relying on video consultations too much? Anybody want to raise a hand if they'd like to make any points? Chris, thank you.
Yes, I think the first thing is, administratively, this is not what booking systems are necessarily set up to do. And so actually moving patients in and appointments into this setting is administratively often quite complicated and burdensome. And certainly when we first introduced this, we actually probably had the same amount of time spent with patients as were in the consultation, trying to get the information to them, helping them to find the logins, helping them to get their IT tested. And so in a quick turnover clinic, that can be very, very difficult. I think what we're seeing in patients who we see regularly, and as Claire alluded to, have the relationship with us already and the patience to bear with us, that actually bears fruit, because that's that time spent getting patients who you see regularly onto this system, getting them competent with the technology, in some situations actually helping them to acquire the technology that they need in order to communicate in this way, is time well spent. In busier clinics where you might see a patient once, then it can be very difficult and time consuming to get them into the right system and in the time limitations that we have available.
And Christian, I know you've made a point to me when we were planning this webinar about the importance of the poor admin team of suddenly being lumbered with this whole new way of working. We'd like to share your thoughts on that.
I think it's been a challenge, and it almost feels like there needs to be a bit of investment in getting the admin right, because if we can get the appointment to work, there's so much to gain from it. So a small investment to support that would actually be worthwhile. I mean, there's a number of hurdles that we've had to go through, as in the admin team also needs to know how can they actually explain to the families how to get onto the system. And I think one of the biggest drawbacks is when it doesn't work, it can get very frustrating. And what do? Do you fall back to telephone? Do you fall back to a repeat appointment, which is frustrating for everyone? And in an example, I had one clinic where for some reason my families ended up in the neurology waiting room, which I don't have access to. And so they were waiting to see me, and I was waiting for them to come into my waiting room. And then after, for one patient, they came into my waiting room at a point that I had to see the next patient. So I couldn't see them, and that was actually really frustrating for them. So I think it's that making sure that everybody knows what they're doing and getting that process right. Otherwise, it can become very frustrating, I think.
So, I mean, there could be a perception, couldn't there, that this is easy for admin staff. It's all over to you doctors now to organise it, but that's not the case, is it? So what do we need to do to support admin teams?
I think training is absolutely key. Can you hear me?
Yes.
Yeah. So training is absolutely key, but I also think knowledge and improving awareness amongst everybody, clinicians included, is key as well. There's always this fear of doing something new, isn't there? And I think one of the repeated comments I've had in recent weeks is, oh, I did my first video consultation this week. It was really great, Claire. Why haven't we been doing it before? I think it's about trying to reassure other clinicians that it's actually okay, and then but also explain to them that it is time consuming, and you have to bear with the admin staff and get them on board as well, and work together as a team, as well as it's not just the admin team, obviously it's if our management team, they need to understand the real issues and what's needed. And yeah, it is frustrating when it doesn't work, but actually I've been surprised at how laid back families have been when it doesn't quite work. You know, I've had occasions where actually the sound's gone, or actually we've not had the sound from the word go. So we very quickly say, well, we've only got half an hour here, let's just go to the telephone. And the telephone consultation then goes okay, as long as you've got them on speakerphone. Because they've seen you, even for that brief moment, it makes such a difference. And now I know this might not be for everyone, and I'm very, very conscious of the fact that I think this is a system that works well for children. I'm not, you know, I think there would be more drawbacks with adult patients, but I think it fits so perfectly with children and with paediatrics and child health.
Thank you all. Now we're going to bring Daniel back in a minute, and Imogen and Rachel. Do any of you have any IT points for Daniel? Anything? I mean, poor Daniel will be covering his ears in horror now, but if there's anything you want to say on the IT side of things that is needed, is there any point you'd like to make? Chris?
Yeah, I think one of the true strengths of this system is the ability to have the MDT and to have more than one person on a call. I think the platform currently probably struggles a little bit more with that, and we do see, I do a general paediatric clinic where I'm just on calls with myself and the patient, and I never have any technical issues. Whereas the more people you load onto a call, the more you start to see the system slow down, the more it starts to throw people off, the more of a delay there seems to be on the line. I think we also have to remember that many of our rural communities actually really struggle with the Wi-Fi speeds, and so we know certain areas of rural East Lancashire I can guarantee the clinic that I do tomorrow in Rosendale is going to be really hard work, and I'm certain that that is due to the broadband speeds that we can achieve in that area. Whereas when I'm doing a clinic mainly of, say, central Blackburn patients, actually the clinic seems to go an awful lot smoother. So I think we have to accept some of the infrastructure problems that are that are relevant to that. I think the other thing is that and Daniel may help me on this, but I suspect that the quality of the device at the other end makes a difference. And that is, again, something I think we have to be aware with health inequalities. 40% of our population in East Lancashire are in the most deprived areas. The devices tend to be cheaper. The resolution of the cameras tends to be poorer where we are using those, and that does affect the quality of the experience. And I think it's really important that we remember that this relies on a certain quality of technology on the other end, and that has the ability to widen health inequality if we're not careful.
Thank you. Daniel, we've also had some questions in the chat, some comments in the chat about it doesn't suit all patients either, does it? So somebody's got children on the autistic spectrum, for instance, who can't cope with video calls. So it isn't going to suit everybody. We know that, don't we? Daniel, do you want to respond to any of that?
Yeah, so I'll cover a couple of points if I may. So, with any new system, our priorities are very much about stabilisation. And I know it's a really old euphemism to use, but we're effectively building this plane while it's flying. We've scaled a system from nothing to millions of consultations in such a short period. So what we were expecting to do over a couple of years, we've had to really shorten, and we're focusing a lot of national effort to make it sure it's as simple as possible. So in terms of the administration, most of the systems that we have in place are digitally and operationally built for in-person appointments. So this is a huge shift away from that, and we've got to start to collectively learn, both digital, the administration, clinical staff, of what does that mean about how we change our process, but also how we change the design of the systems. And the frustration when it doesn't work is that you end up wanting to launch the computer through the nearest window. That's a familiar feeling for those of us that work in technology. But some of the things that we are doing, so we are outfitting clinical rooms with the technology so that it can be both, as Christian said before, both virtual and face-to-face appointments, because that's what we want people to be able to do. That has implications on infrastructure. So as people are using video calls, it uses much higher capacity on networks. You need greater bandwidth. If you're going into rural areas, you can be lucky if you're going to get sort of like a text message every half an hour, because the signal simply isn't there. And certain parts of Cumbria simply don't have coverage whatsoever. So this has been a massive challenge nationally for our, the national broadband carriers like BT and Virgin, etc., to actually cope with the sudden increased demand on working in a different way, not working in offices in a town centre or a city centre, but actually working from home or being able to access things from home. You touched on a very important point, Christian, about not everybody is tech savvy. Digital inclusion is absolutely the centre of what we're trying to do in Lancashire and South Cumbria. And it's about making services accessible to all patients, not just those who have the latest smartphone or know how to use it to chase a Pokemon around a local neighbourhood. We've got to start making sure that people can access service in different ways. And for some patients, and you mentioned autism, but also for dementia patients, video consultations might not work because it's more than just the audio and visual senses that you pick up. It's all the sense of smell and sense of touch. So as Claire mentioned before, some adult patients, that might not work well because you now need to be in a physical setting. And since some of in the Netherlands have been looking very much at the technology and say, well, actually, it doesn't work for dementia patients because dementia patients are triggered by smell and sound and touch. So, we've been looking at a lot of that. We've been looking at the Wi-Fi and 3G networks to make sure that is nationally uprated. But sometimes it comes down to the simple point of turning around and telling the kid, get off the games console so I can do my virtual consultation and not use all the bandwidth. So it's those little challenges that you get at home. And I've lost count of the amount of people that I've been on meetings with who've had to, you hear them in the background turn and say, you're going to have to stop playing on the PlayStation or other things are available because I need to do this video call, etc. The big difference is, this is not just simply like FaceTime, TikTok, look at me, down with the kids, or Snapchat or anything like that. This is a completely different setup. So, You know, we have to make sure that it has a waiting room, it's got clear resolution video, it's confidential. You know, the ability to share documents and screens and other clinical features to make sure that it is still secure. So it's not just a simple video app. But then again, the system must be easy to use so that patients don't have to start downloading apps and creating accounts and doing all that sort of stuff, can just access the system. So there isn't much choice out there at the present time. So, you know, Attend Anywhere was kind of sort of slowly being launched. So we chose that as the current product. What we start using in the future can be very different, and the technology changes at such speed. If you had told me in January we've been doing 4 million patient consultations nationally, I'd have turned around and asked you for the lottery numbers, quite frankly. But what we're finding now is that clinicians and patients alike have responded generally in a positive way. And whilst folks are embracing the use of technology, already what we're looking at is what we can do to enhance and improve that technology, and start to say to these companies, actually, how can we do this better? Can we do this? Can we do that? So that bodes really well for the future, because what it says to us is, how can we collectively design and seize on what we've done over the last 4 months and say, what can we do to make this even better? And not just about virtual, but about the patient experience as a whole thing.
Thank you, Daniel. I think this is a good point at which we ask the audience how they feel about video consultations. I can see the chat coming in and some excellent points being made. If you've got a question for the panel, please put it in the Q&A function. But we've now got a poll, or is it poll? A poll for our attendees, and it's, how comfortable are you with video consultations? You can answer this if you're a patient or a clinician or a manager, you know, whoever you are. We'd like to know how comfortable you are. So it's a very broad brush survey, but it'd be really interesting just to get a feel for how comfortable you are indeed. And while that's coming in, so let me just have a little look at the questions. There was one a moment ago. I thought, wow, that's...
Answer one for you, from Deborah Moore. Has anybody seen these video appointments within mental health? Yes, yeah. Very much in Lancashire and South Cumbria. About half of the 650,000 that we've done since March are in mental health and community.
Which is a success, isn't it? That's a very big proportion. Right. So while the poll's coming in, should we just leave it open a bit longer? Hope everyone can find it. So if you haven't done one before, it should be, if you're on a laptop, it's at the bottom of your screen under polls. Just go there to find it. So the result seems to have settled down. Most people are saying they feel comfortable, which is like the second degree answer, isn't it? 55% say they're comfortable with. 28% say they're extremely comfortable. That's just changed to 27%. 11% are neither comfortable nor uncomfortable. 5% are uncomfortable, and 1%, which is one person, by the way, 1% is extremely uncomfortable. So how does, Daniel, how do you think, does that reflect your perception of how well it's being received?
Yeah, it's people will respond in different ways. I mean, as colleagues have said, you know, this isn't the right thing for every environment. It's the right thing for some environments, but not all. So yes, the general sort of feedback is people are very enthusiastic about it, but also recognise its limits and say, you know, it isn't the right thing to do for every consultation. There are times when a face-to-face consultation is absolutely clinically right.
And I mean, lots of questions about what if we can't do it? What if this person can't access it? Is there a choice? Do patients, yes, Chris?
Yeah, I think the really important thing is that we provide individualised care. That's what we all want to do. But actually, and I think this is probably very similar to what many in education will have found. There are some families for who this is an absolute dream. The stats that Daniel described about time out of education, and we've got to remember that children have a right to their education. We disrupt that massively through our healthcare appointments sometimes. And but so there are many families where it works really well. They have access to technology, they have the knowledge. I work in diabetes, which is a very IT driven thing. Patients upload their meters, they upload their software, they upload their pumps, and actually they can move seamlessly onto this platform. What I think actually in face-to-face appointments before now, we've been very guilty of a one-size-fits-all approach, and actually say, well, the family that actually don't need to come and see us still are dragged to the hospital, even though actually that appointment is maybe not that valuable for them, and we could have done that in a different way. So what this actually allows us, we do still have face-to-face capacity, we do have hospital estate. Let's use that estate for those patients who need it, where we either need to perform clinical examination or that actually it works better. There are many patients, I've polled our patients who are using it. Interestingly, 98% of them want to carry on using it, even though 40% of them said they had problems with the technology. So they, in their view, they're actually happy to deal with some of the gremlins for the benefits it gives them. And but there are some patients who it clearly doesn't work for. So let's give those patients more time in clinic to be able to actually sort out their issues, to give them that face-to-face attention, really, whilst accepting that we can all improve our efficiency and improve the individualized service by doing, you know, different things for different people. And yes, that takes quite a lot of reform in terms of being able to think, and certainly sitting in clinic and doing the mental frame shift between seeing somebody in the chair next to you and then having to shift onto the computer and then having to shift onto the telephone. That can be challenging for us as clinicians, but actually that provides sometimes the individualized care that patients deserve.
Absolutely, I couldn't agree more. I think the fact that what this has done is it's really raised the fact that we've got to be more flexible as clinicians, but it also gives us the opportunity to be much more involved in the planning of our clinics, and we should know who's coming to our clinic today. We should have planned, and I think what it's highlighted for me, I think you wanted us to give some tips at the end for video consultations. I think for any clinic, what it's told me is that you really need to have time to plan for your clinic. So you shouldn't just arrive at 9 o'clock in the morning to be doing a clinic. Who's coming today? No, you should absolutely know who's coming and what form it's going to take. So I think it's a real shift for us as clinicians to get that, and we'll get there, I think. I mean, I'm a complete technophobe, believe it or not, but I'm a complete believer in this multifunctional aspect of outpatients and giving the control and the involvement to the clinician and not just leaving it to the managers or the administrators. I think that's absolutely key.
Yeah.
Thank you.
And crucially to our patients, I think, as we say, asking them what they want to do. But I think it also focuses us on what is the purpose of that appointment. You know, if the purpose of the appointment is information giving and explanation, then as we say, why go through all the sort of debacle of trying to find a hospital parking space? If it's for clinical examination or for procedures, then clearly we should know that in advance and plan it that way so that we don't waste capacity, so that we don't have a phone call where we could have predicted that phone call wasn't going to help, you know, or we don't have a video consultation if actually that's not going to happen. So it's the planning, and that comes back to how we link in with administration and how we do that individualized planning.
So what we actually, one of the reasons it makes more work in a way is sometimes you will see a patient, a new patient perhaps over video, and you'll realise during that consultation, no, I need to see you and I need to see you next week. And so that's where the extra workload for the admin staff comes in. But you should be able to do that, and that's what we've managed to incorporate here in Lancaster.
There is something in the chat I feel I need to raise because it's someone's obviously quite worried. Someone's saying, I worry about those children who can't engage on video consultation being pushed further down the lists. Does that happen?
Yeah, so with us, that wouldn't happen, because what we do is we first decide on the urgency of the appointment, and then we decide on the mode of the appointment. And if it becomes obvious when we're booking the appointment that it's got to be face-to-face, or, you know, it can't be video, then we'll you know, it doesn't dictate. They're not going to, people who will be seen by video will not have preference over people that will be seen by another method.
Great, thank you.
I mean, I wanted to very much add, I think it's always going to be a mixture, and there are some appointments where you have to see the patient. Like Imogen said, if we want to have a good look at her, look at how strong she is, how her muscles are working, we need to see her face to face. But if it's a catch-up meeting, say, how are you doing, what difficulties have you got in school and things like that, there's no need to do that physically, we can just do it over the video. So I think there'll be a mixture. And similar, I think there's some families that will struggle with the video consultation. Then there is always that option to have the face-to-face. So I think we're going to be working with a mixture of both together. And if we can do that within the same clinic, that actually works best, like Claire says, because then we don't have to prioritize or anything. We just give what this patient specifically needs. And from my experience, I don't think video consultations are necessarily any longer or shorter than a face-to-face consultation. So actually for a clinic template, it doesn't actually make a difference. So that's what would be my feeling, that we have that mixture going forward.
One of the other advantages might well be as well, I don't know if we've got evidence of this yet, but less non-attenders. If you blanketly say, oh no, it's all face-to-face, you're likely to have non-attenders. Whereas if you have already talked about the mode of the consultation, I just wonder whether we might actually have fuller clinics and become more efficient. You've got, your DNA rate maybe it will go down, which would be a good thing.
Definitely worth knowing that. It would be very interesting to find out, wouldn't it? I'm just looking at some of the questions because we're now in our Q&A slot. One is from Brent Horrell. Can I ask how you've managed providing medicine supply to patients following your virtual clinics? Would anyone like to answer that?
So we can send a letter online to the GP asking them to prescribe. That's how we overcome that. Or if they live close to the hospital, they could always, we can get a prescription to our Lloyd's pharmacy, and they can come to the hospital and collect a prescription. But generally, we should be able to communicate with the GP and ask the GP to do the prescription.
Thank you. Question for Rachel and Imogen. From anonymous attendee, Rachel and Imogen, do you prefer video consultations, or do you miss seeing your specialist team face to face?
I don't really mind either way.
I think for me, I think they are very good, but sometimes you need to touch base and see the consultant, because it would be interesting to sort of see some of the assessments that they do, how much you can do at home and how much you can do in the hospital, and just compare. But I definitely think there's a place for them, and they're very useful.
Okay, thank you. Before we finish the webinar, everyone attending, if you would like to put in chat any tips that you've got for making a video consultation go well. So whatever your perspective is, patient, admin staff, manager, clinician, if you've got something you think, I wish they'd do it like this, or I wish they would all do it as good as this, what's the thing that you think is really important to making it work well, that'd be useful, and we'll compile those later. And we've got the recording of this, we're going to have a transcript of the chat, so we will share these afterwards. There's just another question here which I think is a good one. I'm sure it's in place. It's about tackling those inequalities of access. I saw one here. Oh, here we go. From Jane Marshall. Are there plans to support parents and young people who may not have the tech or Wi-Fi or data capacity to use online consultations at home, so we reach as many people as possible from a health equality perspective? Daniel.
Yes, so absolutely. And what I will say is that as we cover the Northwest, Lancashire and South Cumbria is actually leading in this area. So sorry, Cheshire and Mersey and Greater Manchester. We have a number of clinicians that work within our digital team that are nurses of many, many years, and psychiatrists. We've got our Chief Clinical Information Officer is a leading psychiatrist and psychologist. I always get the two mixed up, sorry. So digital inclusion and digital exclusion are absolutely key priorities. So we are trying to make sure that, so I've noticed a couple of comments, we shouldn't be assuming that everybody has a fully functioning mobile phone or device that can do this. We have, great areas of deprivation across the whole of the Lancashire and South Cumbria County. So what we are trying to do is to make sure that any of these systems that we're trying to do is to make sure we're working with local authorities, social care, housing, all the different agencies, to make sure that people have got equality of access which is a very, very important thing for equality of access, whether that's being able to go somewhere to access these services, you know, a local library, something like that, that's something that works for them, or whether that we can sort of work with national providers to help them get access to technology. So there's a big shift nationally around this, but Lancashire and South Cumbria are already very much, long before COVID, for the last few years have been looking very much at digital inclusion. So, you know, it's a passion that very many of us have.
Well done, Lancashire and South Cumbria. Thank you very much, Daniel. We have to draw it to a close now because we've reached the end of the hour, but thank you so much. It's been fabulous to hear from you all. Thank you for sparing the time, staying behind Imogen and Rachel after your appointment, and joining us all online. And thank you so much for all the participants as well. As I say, recording will be available and we'll share it to everybody who's registered. So thank you, Imogen, Rachel, Daniel, Claire, Chris, Christian, I think I've mentioned everybody, and to our backroom team, Mike and Phil, who have made it all work properly. Thank you very much. So thank you. And if any suggestions for future webinars, just email us at the Innovation Agency.